today we have had 11 new cases, 10 who have been tested positive, and 1 epidemiologically linked case, bringing our total in BC to 2,756 people with COVID-19. 940 people are in the Vancouver Coastal Health Region, 1,426 in the I'm going to check that number. In the Fraser Health Region, 130 on the Vancouver Island Health Region, and 195 in the Interior Health Region, and 65 people in Northern Health. We have 1 new healthcare outbreak to report today, and that's the Maple Hill Long-Term Care Facility at Langley Memorial Hospital. That leaves us with 5 active outbreaks in the healthcare system, and we are now up to 579 cases, including 357 residents and 222 staff who have tested positive in our acute care system. We continue to monitor and support at the 5 locations that we have active outbreaks in the community. So we now have 172 active cases, of whom 11 are in hospital at the moment, with 5 people in critical care or ICU. There are no new deaths to announce today, and 2,416 people have fully recovered here in BC. As you know, we are gradually continuing to ease restrictions. And our objective as we move into these phases of our restart here in BC is to keep our cases of COVID-19 low and to make sure that we slow any growth in our communities. To do this, we have been and will continue to open what is safe to open and keeping closed those things that are more risky. We know that closed spaces, particularly closed spaces with poor ventilation, close contact, particularly if it's over a period of time, and crowds are the higher risk. So things that involve these will continue to have restrictions in the coming months. We are being thoughtful and measured in our response, and we're adapting as we go. It is a gradual transition, and we're slowly turning up the dimmer switch as we learn to adapt at each of the stages that we're going through. There are many things that we can do safely and that we continue to do, and we've learned along the way how to do that. We were able to keep grocery stores and pharmacies and other essential businesses going, and we worked through how to do that. We figured out our safe distances, the things that we needed to put in place to reduce constriction within facilities, within stores. We used our small numbers. We used masks when we couldn't maintain those distances. Once we flattened our curve, we started to open up more of our retail stores, restaurants, and then we adding back the surgeries and other things in our healthcare system. And then we moved into the transition of some return to in-classroom teaching in our schools so that we could learn how to do that and how to adapt in that system as well. We've since modified and expanded our options for restaurants to take advantage of things like our summer months and the patios and to support further reopening with things like engineering controls, like barriers in place, smaller groups that keep both the groups and the servers and the people who work in restaurants safe. Looking ahead, we're going to transition to developing these guidance for more things like spas, resorts, activities like recreational sports, and we're working to be able to safely restart other parts of our economy. And we're developing the tools in partnership with the BC CDC and with WorkSafe BC to be able to do this, and to all of us to understand how we can use our foundations to continue to make it safe. So businesses and the ones that have opened are learning that these layers of protection are what we need to safely operate to protect ourselves, our employees, our customers, and all of our businesses. What also stays the same throughout this pandemic, however, are the personal measures that we have learned and that we'll need to keep following to keep ourselves, our communities, and our families safe. Frequently washing our hands, always staying home when we're ill, maintaining our safe distances as much as possible, the whole concept of fewer faces and bigger spaces, keeping our contacts low, especially if we have people in our household who are at risk of having severe illness from this disease. We know that these are our foundations for our protection and for our path forward. And closed spaces, close contact, and crowds are riskier for all of us. That's why things like family gatherings, either at a home, at a nightclub, or even choir practices, where people are inside and close together for an extended period of time, significantly increase the risk of transmission. And then we risk bringing that into our families, into our workplaces, and spreading it in our communities. We will have the opportunity to do these things again, but just not now. This is not the time to take those risks. It is far easier to maintain a safe physical distance from 4 people than from 40, and those are the things that we need to think about now. It is also much faster for us in public health to do the contact tracing we need to keep suppressing this virus in our communities when there are only a few locations to monitor and fewer people to alert when we have an increased risk. It only takes one person in a crowded setting to spread it to many others, and we have seen that around the world, but we've also seen it here in our communities in BC, whether it's a long-term care home, whether it's a group of people, a family gathering, whether it's a restaurant where employees are together, whether it's a workplace like some of our meat processing plants, for example. Our most effective way to manage COVID-19 in our communities is to continue to work together, to take care of each other, and to do our part. This is not forever, but it is certainly for now. Until we have the tools to fully stop this virus, we need to continue to take these measures as our foundation, and we need to continue to do this together, to be kind, to be calm, and to be safe.